Hi friends, this is Dr. Pallavi Singh and today we are going to discuss on the topic peptic ulcer. The peptic ulcer is an erosion of the GI mucosa resulting in the digestive actions of the HCl and the pepsin. The site of peptic ulcer can be the lower esophagus, duodenum and the stomach, and we can also find in 10% of the men and in the 40% of the women. They are of two types, the acute and chronic. The acute is the one which is superficial erosion or minimal erosion, but the chronic is the one which causes mucosal erosion or mucosal wall erosion and formation of the fibrous tissue. It is also present continuously for a month or it is present intermittently. The etiology and pathophysiology, this is developed only in presence of the acid environment. Then there is an excess of gastric acid, not necessary for the ulcer development, but the person with the gastric ulcer has normally to less than normal gastric acid as compared to the person with the duodenal ulcer, and also some intraluminal acid does seem to be in the essential for the gastric ulcer to be occurred. Pepsinogen is activated to pepsin in the presence of HCl. Secretion of HCl by the parietal cells has a pH of 0.8. pH reaches 2 to 3 after mixing with the stomach content. At pH level 3.5 or more, the stomach acid is neutralized. The surface mucosa of the stomach is renovated after or about or every 3 days. Mucosa can continuously repair itself except in the extreme condition or extreme instance. So the mucosal barrier prevents back diffusion or acid from the gastric lumen through the mucosal layer in the underlying tissues. The mucosal barrier can be impaired and back diffusion can be occurred. Coming to the pathophysiology, the acid, bile salt, aspirin, NSAID, alcohol, ischemia and H. pylori are the main causes for the pathophysiology. They break down of the gastric mucosal barrier. This breakdown causes acid back diffusion into the mucosa, and this causes destruction of the mucosal cell, and this destruction causes increase in the acid and the pepsin release. Then once there is an increase in the acid and the pepsin release, it causes further mucosal erosion and destruction of the blood vessel, which also causes bleeding, and ultimately it causes an ulcer. Now the acid back diffusion into mucosa also causes histamine, and this histamine also causes the increase in the acid and the pepsin release, and then it repeats the same step and causes ulcer, and it also repeats the increase in the vasodilation or the increase in the capillary permeability, and then this to increase causes loss of the plasma protein and the gastric lumens, and also the mucosal edema is formed, which causes ulcer in the body. Next is the protective mechanism. The mucus from a layer that entraps or slows the diffusion of the hydrogen ions across the mucosal barrier, which is the bicarbonate secreted neutralized HCl acid in lumen of the GI tract. The gastric ulcer is characterized by a normal to low secretion of gastric acid and there is a back diffusion of the acid in the greater, which is greater, and which is also causes a chronic effect. Then there is a critical pathologic process in account of the acid able to penetrate the mucosal barrier. The duodenal ulcer, this is caused in between of the age of 35 to 45 years and also they are in account of 80% of all the peptic ulcer, and which is also associated in the increase in HCl acid secretion. H. pylori associated in the 90 to 95% of the cases of the duodenal ulcer. Drug therapy, they are antacid, H2 receptor blockers, proton pump inhibitors, antibiotic, anticholinergic, and the cytoprotective therapies. Next is the histamine receptor blockers or H2 receptor blockers. They are used to manage the peptic ulcer diseases by blocking the action of histamine on the H2 receptors, and also decreases the HCl acid secretion and decreases the conversion of the pepsinogen to the pepsin. And next one is the proton pump inhibitors. They blocks the ATPase enzymes that is important for the secretion of HCl acid. Antibiotic therapy eradicates the H. pylori infection, and also no single agents have been affected by eliminating the H. pylori. Next is the antacid used as the adjuvant therapy for the peptic ulcer disease, and also it increases the gastric pH by the neutralizing acid. The main goal for the treatment of peptic acid, that is complies with the prescribed drug or the prescribed therapy regimens, and also experience a reduction of the absence of discomfort related to the peptic ulcer disease, exhibit on no sign of the GI complications, have complete healings, lifestyle changes to prevent the reoccurrence can be done. Thank you so much for patiently listening on peptic ulcer. Meet you in the other video. Thank you so much.